As the COO of RN Cancer Guides, I'm here because my background is primarily in operations and healthcare administration. And I use my experience, which was overseeing medical facilities and surgery centers, and I put that into day-to-day use here in the operational aspects. Patient navigation, while it may seem like a very new concept, has been around for a while. It was actually started in 1990 by Dr. Harold Freeman in Harlem, New York. He found that there was a large population of people that had great disparities in cancer care and treatment. It was primarily African American women. And what he did is he decided to formulate a program so that they could have access to diagnostics for early treatment, and then have assistance in navigating through the treatment process. And there are many studies that you can look up on Dr. Harold Freeman's work in Harlem and how it greatly impacted that population, how it reduced cancer deaths, breast cancer specifically, in that population. And I think that was really the beginning of healthcare understanding and agreeing that the system is complicated and convoluted. So while, again, it's not a brand new service, it is now becoming something that people are much more cognizant and aware of. We are really trying to change the climate so that people understand and feel that when they're facing cancer, they need a specialist on their own side. We may, at first glance, envision that specialist as our practitioner, but what we have to realize is that we're not that practitioner's only patient. And while they call it medicine, we need to remember that they call it the practice of medicine. And so because of the evolution of cancer care, because of the ever-changing methods of treatment, chemotherapies, surgeries, alternative therapies, because of those items, somebody needs to be there for the patient to say, well, here are some other options, because we know that practitioners can get very single-visioned or tunnel-visioned, if you will, and they start to treat patients in protocol as opposed to as an individual. And I don't fault the physicians for this. We don't fault the physicians for this. It happens, and it's practice. That's what they do. But patient navigation to us is really customized, and it's assisting each individual in the method that they require. We may have one person who needs assistance navigating through their healthcare plan and finding people who are on the program. We may have one person who needs assistance navigating through clinical trial prospects. Very complicated work, clinical trials, and finding out if you're able to participate, if you're a fit for that trial. And because there are just so many specific things, it's really important to have that navigation piece. And we're happy to be able to provide that for our clients. As a cancer patient, there are a lot of steps that you have to navigate through. And I can tell you from the immediate prospect of having cancer, if you're facing symptoms that you're unsure of, if you found a tumor, a mass, a lump that you're unsure of, the uncertainty kind of starts right there. As a patient, you question, who do I go to? Do I see an OBGYN? Do I see my primary care physician? And that's just the start of the roller coaster. Essentially, that's the waiting in line to get on board. And the roller coaster that ensues from there is overwhelming. I like to think that patient navigation is kind of like your seatbelt, if you will. Make sure that you don't fall out of that roller coaster. What happens in the process is, you start off with a general practitioner of some sort. Typically then you'll have some sort of scanning, MRI, ultrasound. Biopsy comes after that. Then you may see a surgical oncologist once they determine what they're going to do with that cancer. Is it operable? Is it inoperable? You may see an oncologist who's going to help you determine if you're going to have chemotherapy. You may have a radiological oncologist who's going to do the radiation aspects. Then you may have somebody that you see afterwards for pain and palliative care. You have a surgeon, you have these oncologists. Ultimately, you can have 10 or 12 practitioners that are a part of this roller coaster, if you will. And connecting those practitioners is very complicated. Even if they're all under one roof, it's very complicated. We often find as navigators that person C in the chain doesn't have the same information as person F. Or we may find that the surgeon number 1 who has to correlate with surgeon number 3 aren't necessarily on the same page. And as a patient, that's frustrating because you think, this is me. All of you guys are incorporating my treatment. How can you not understand? How can you not be on the same page? And what we do as navigators is we make sure that they are. So surgeon 1's notes will go to surgeon number 3, so that surgeon number 3 will know exactly where they need to pick up. It really should kind of be like a tag match, you know. We're wrestling around here. We're wrestling for our lives. And, you know, we need to tag in our teammates and they need to just be seamless. And unfortunately, that doesn't happen. One of the other concerns that I experienced as a family member in the loss of my mother-in-law, which unfortunately actually occurred while I was battling my breast cancer, is a breakdown of communication. And this specific communication that I'm referring to is the facts. The truth, the upfront, the ugly, the honesty. There are a lot of providers who deal with best case scenario, and I believe that they do this with the utmost compassion. They want family members to be at ease, and they want to put our minds in a place of well-being. But when we have patients who are told that they have 2 to 5 years and are passing away within 6 weeks, there is easily, identifiably, a breakdown in honest and upfront communication. As a navigator, we use only oncology certified nurses. And these nurses are familiar with the signs and symptoms that indicate that we no longer have the optimistic outlook, that we no longer have years, but rather weeks. And all of our patients comment on how much they appreciate the information being upfront and honest. And all of their family members tell us how much they appreciate knowing the truth, because rather than putting off that wedding for a year, they bumped it up. And although everything was put together on a whim, they got to have their loved one there for that amazing ceremony. Rather than putting off that vacation to Europe till next year, they decided their treatment wasn't going anywhere. And while they were still healthy and able to be active, they made memories with their families. And unfortunately, the way that our healthcare is right now, I think that people feel like they're being misinformed. And when they have that feeling, they're left with a genuine sense, not only of loss, because that happens no matter what, but of being cheated, of being gypped, if you will, of that time that they thought that they had with someone. And as sad as that is, and as painful as it is to say and to address, patients and their families and loved ones deserve to know the truth so that they can make decisions that will best utilize their time. We need to focus as patients on getting better. We shouldn't have to focus on the administrative aspects of our care. And that, unfortunately, is really the direction that healthcare is moving these days, is making the patient a consumer responsible for their own administration. And it's difficult. As a patient facing cancer, we look for answers. And having a navigator is having that third voice. It's having that person who can give you those answers at 3 a.m. on a Saturday morning when you wake up with hives and don't know where to go. The benefits of having a navigator are so varied and vast. It could be somebody who finds financial resources. It can be somebody who helps to coordinate your care so that if you're like me and you were a patient who was working through their treatment, when you're in the office, you can focus on your work, as opposed to trying to focus on coordinating appointments or getting your medical records together for all of those different providers who don't talk to one another. The benefits of having a navigator are so individualized. It really is customized to each and every client. But what the constant is the outcome. We have better outcomes for patients who have navigators. They're better educated, and so they're more compliant patients. And because of that compliancy level, they have better outcomes. These patients are also dealt with in a capacity that is much more one-to-one when they have a navigator. I feel like for the physicians that we work with, they understand how important this person sees their health, that not only are they battling this on their own, they brought in a coach, so to speak, to help them win the game. And I think that's one of my favorite parts about navigation, is being there for each and every patient in whatever method or way they need us.